Hi there, I'm Commissioner Kelley Minty Morris, and we're going to talk to you today about antibody testing. You can see I have been wearing my mask, as are the doctors with me, but for the sake of this interview, so that you can clearly hear what we're saying, we are going to remove them, but the recommendation is that you wear these masks whenever you are in the public. And with that, we'll get started. I have both Dr. Niskanen and Dr. Montjoy here. Thank you so much for joining us for this. So antibody testing is a really hot topic right now. And rather than try to explain it from a layperson's perspective, we really wanted to come to you, the medical community, and have you lay it out for Klamath County because people are asking about it and they're really curious. So we'll start with this, just the basics. People are talking about antibody testing. Dr. Niskanen, what is antibody testing?
So antibodies are proteins that your body makes in defense of the infection, such as a virus or a bacteria. And these proteins, they're very specific to certain things, but there's also some cross-reactivity, and there's different types of these proteins, or what we call actually immunoglobulins, or synonymous with antibodies. And there's IgG and IgM. And there are tests for both of these for COVID-19 virus at this point. The test that we're currently using here at Sky Lakes is an IgG test.
Okay, and thank you for pointing that out. You know, we're here at Sky Lakes. Sky Lakes is very fortunate in that we're able to do antibody testing. Antibody testing isn't everywhere in the country and not even everywhere in Oregon, so that's a major benefit for us here in Klamath County. Now, there are some differing thoughts on the value of this and how we evaluate it. From your perspective, Dr. Montjoy, how are we going to evaluate this, or why is this significant that we have it?
Yeah, it's really interesting. All across the country, they're using antibody testing in a different way, and really across the globe, they're starting to experiment with some social models and potentially using antibody testing for decisions like reopening governments and that sort of thing. We're not there yet in the United States, but what we are able to use it for at this time is potentially tracking cases that were not picked up earlier with the PCR testing, the nasopharyngeal swab. So if someone missed the opportunity to get that test when they had symptoms, when that testing was still unavailable, or identifying asymptomatic carriers or folks who had the virus and were asymptomatic. And particularly in New York right now, they're finding that that could be more than 25% of the population. So that's going to help us both calculate the mortality rate of the disease, but also how far spread it may be.
So there's clearly a difference between COVID-19 testing and this antibody testing. So will you simplify that for us? What is the difference? There are even different kinds of tests, is my understanding.
So the first test that came out was called the PCR, which is the polymerase chain reaction. And what that means is they take a snippet of genetic material that's within the virus and they just multiply it actually hundreds of thousands to millions of times until it's actually detectable. And that's a test that typically takes us anywhere from 3 to 5 days to get those results back. That was the nasopharyngeal swab. And so they were getting the sample and then sending it off to a lab that does this polymerase chain reaction. The other test that has come within the last month is something where they are using snippets of genetic material, but they can do it rapidly. They're looking at the genetic line there and they're taking little snippets and they match it up, and if they get enough matches, and that's the rapid testing that's genetic. And that's where you hear about people that have testing that can be done in less than an hour or 4 hours, depending. In our state, only the bigger institutions such as OHSU, Asante, St. Charles actually just got some of that. We're trying to get that for ourselves because it really helps for us to get some rapid testing to help tell us if the person truly has COVID at this point, or we have to wait for 3 days or plus to get those results. The next thing on the horizon is something, then you've got the antibody testing. And we've already talked about that. And that's just a blood test actually. So we're measuring it from the serum and we're seeing if you've been exposed to it. Now, people who are positive for the antibody may never have had any symptoms or very mild symptoms or could have been deathly ill. And so there's a large variety of sort of the amount of antibodies people can produce toward those different types of stimuli. The last one that's in the horizon, it's still probably a month to 2 months off, is something called antigen testing. And that's what we do for our common flu, that when you get the nasal swab done and they send it off, they're just looking for a set of proteins that's common to that particular virus. And that's typically also rapid testing, There is some inaccuracies to it, but again, the more proteins you have, the more accurate it can be. But it's also relatively cheap, and that's a thing that people think that in 1 to 2 months we'll be able to have much more rapid testing across the U.S. when that's developed.
Okay. And then, this question might be a little bit controversial. Again, I'm not a medical professional, but are you encouraging widespread testing? Should everyone get antibody testing, or who is really the right candidate?
Yeah, it's a wonderful question. What we've decided as Skylakes as an organization is to try to make it available as possible to everyone in the community, but we are encouraging it for specific populations, and those are primarily healthcare workers, first responders, persons who may have been exposed, and particularly those who have had symptoms but have never had the nasopharyngeal testing.
Okay, great. So as we conclude, I want to give you each an opportunity. Are there any last thoughts you'd like to share with folks? I mean, you've truly been on the front lines and are the experts, so you're the ones we'd like to hear from, and I'll start with you.
I think we are getting to the point where the economy is really suffering at this point. We are going to be opening up, and fortunately in Klamath Falls we have a low prevalence of this virus. I would say anywhere from 2 to 3% with our current testing, but it's still out there, and we still, even as we open up, we need to be wearing our mask, we need to be social distancing, good hand hygiene, and trying to stay away from large groups. Because the problem is it's still out there, and it means that, yeah, a lot of people have not got it yet, but it's also the potential that a lot of people could get it. The vast majority of people that get it will actually do okay with it, but it'd be some populations like our nursing home populations, the older people in the community, that it could be devastating. So we just need to sort of control it until we have some type of herd immunity, and that's either going to come naturally or it's going to come through a vaccine, and we're trying to hold off until we have a vaccine.
And last thoughts from you?
I just want to say thank you to everybody in the community that's been working so hard and so diligently on the COVID-19 response, from the frontline workers, EMS, those in the community, those in the grocery stores, the county commissioners, public health department. This really is a joint effort, and we've all been collaborating, and this is a special community to be in and to fight something like this. So just thank you, and then I'll just throw out a thanks to my grandmother for my mask that she sent me all the way from North Carolina.
Oh, I love that. So again, Klamath County, some of those reminders to just keep in mind: physical distancing, hand washing, good hygiene, wear a mask, and as we've said many times, we are all in this together.